Hey guys, Doc Haps here. So your doc did surgery on your prostate to reduce its size. Now he says it's grown back. What's the deal? Hey guys, Doc Haps here. So the question is, your urologist did surgery years ago to open the channel of your prostate, and now he says that tissue has grown back, you're having worsening symptoms. What's going on? I'll give you the scoop on why your urologist may tell you he may need to do another surgery or why that tissue has grown back. So if you're a gentleman who's had a prior procedure on your prostate, such as a transurethral resection of the prostate, and you initially did well, but years later, typically your symptoms somewhat deteriorate. And that can happen. Unfortunately, the prostate is an organ that grows throughout our life. As long as you have a little bit of testosterone in your system, the prostate will continue to enlarge. Now, depending on when you had your initial surgery, how it was done, the type of procedure that was used, that tissue that was originally resected can grow back over time. Now, in some men, hopefully a TURP procedure or a transurethral resection of the prostate lasts a lifetime, but everybody's a little different. So if you're a younger guy and you have 20, 30 years to live, that tissue may grow back and traditionally does grow back over time. So as your urologist may have suggested to you, if you start to have some symptoms of weakening of stream, poor flow, some urinary urgency and frequency, sometimes your urologist would want to investigate and look in the bladder and look at the lining of the prostate to better understand what's going on. As urologists, there are certain things we're looking for. So after any surgery like you've had, sometimes you can develop scar tissue, which can cause blockage or obstruction. And occasionally it's as simple as opening that scar tissue to help you have better symptoms and improve your flow and stream. That scar tissue can develop in the urethra or where the prostate transitions into the bladder, called the bladder neck. Those two problems are called urethral stricture or a bladder neck contracture. This can develop in people who've had prior surgery, such as that TURP procedure. Now, if it's been years and you've gradually had deterioration of your symptoms, then sometimes that prostate tissue that was resected can grow back enough to where it's causing worsening of your symptoms. And again, a cystoscopy in the office would confirm whether there is a urethral stricture, a bladder neck contracture, or it's just the prostate tissue has grown back. So what do you do for this? Well, for a stricture or a bladder neck contracture, oftentimes we can stretch or make a small incision to open these areas as the first step. And for a lot of guys, that can solve their problem. If the prostate tissue has just simply grown, then we can start with medications to try and relax the prostate tissue. That's Flomax or tamsulosin, or you can start a medicine to shrink the prostate tissue called dutasteride or finasteride. And sometimes these medicines are used in combination to get the best effect. If the prostate tissue has regrown and the medicines are not effective, then sometimes the urologist will recommend that he repeats a transurethral resection of the prostate using either electricity or laser to try and take down that excessive overgrowth of tissue and hopefully get you back to voiding well. So yes, you can regrow that prostate tissue. And in some men, it can cause problems. As urologists, we want to ensure we have the right diagnosis. So if you're having symptoms after your initial surgery, then oftentimes we will look in the urethra, prostate lining, and bladder to understand what's going on. This is Doc Haps. Thanks for watching. Subscribe to our channel. You'll enjoy our other videos. Thanks again.